This was a message I got from one of my patients. She said, so and she was so happy with some of our videos that we made on the menstrual cycle. But apart from that, we are still receiving a lot of message from you saying that you've not yet understood how to really calculate your menstrual cycle. There see some people having a lot of issues. So I'm coming here to give you like the most simplified method. You're going after this video, you're going to understand the easiest method on how you can calculate your menstrual cycle. And I think you won't want to miss out on this. You master your menstrual cycle. Please, please, please. This is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women related health issues. If you're new to this channel, please don't forget, click on that subscription button. And to those who have subscribed, thank you very much and God bless you. Let's dive right in. Let's get that simplest method to calculate your menstrual cycle. Welcome back to Talk Pregnancy with Dr. Noella. Now we're going to be going step by step. Let's go slowly. What is the menstrual cycle all about? We're going to be starting with those who have a regular cycle. Our next video is going to be coming up with those who have irregular cycles. If you have an irregular cycle, don't mind. We are going to do that video, and so don't miss out. For your menses to occur, what happens? There are two main things that have to happen. First thing is, what is the menstrual cycle? Your menstrual cycle starts from when you see your menses. Let's say you see your menses today, that's the blood flow. If you see it today, that is the beginning of a cycle. Now till the next menses. So this is your cycle. This is what they call the menstrual cycle. So the cycle is from when you see your menses today and to the next cycle. Now there are some misconceptions. People always feel like their menstrual cycle is the number of days that it flows. No, it when they ask you what is your menstrual cycle, it means that if you see your menses now, when should you see the next one? Is it after 28 days? Is it after 29 days? Is it after 30 days? That is your menstrual cycle. Now your period of flow can either be, normally it ranges from 3 to 7 days. People who usually have shorter ones, less than 2 days or above 7 days, you can, when you start going above 7 days, it means that you might be having an overflow of your menses. Now this is your menstrual cycle. And if you don't get this right, you can't get any other thing right. You can't get maybe your fertile period, your safe days, or your unsafe days. I made a video on step-by-step methods on how you can get pregnant. And yeah, the menstrual cycle is very important that you should know in order to calculate your fertile period. And this is what we're going to be doing in this video today. Now, if you see from this video, from here, you see from the menses to the next menses, that is your cycle. It's divided into two phases. We have here, we have what we call the follicular phase, and the luteal phase. So the follicular phase, remember we have our uterus. This is, any of you, if you don't know the uterus, sorry for the ink. If you don't know the uterus, this is the fallopian tube, this is the ovaries, then we have the inner lining. Now what happens is, this is the womb, this is the uterus, this is the fallopian tube, and these are the ovaries. When you see your period, when you are bleeding, this is the beginning here. You're bleeding here because you're seeing your menses here. So when you're bleeding, it is this inner lining here which is shedding off and coming down. It is peeling off, and coming down. Both, even this side too, it does the same thing. I don't want to just destroy this side for now. So it destroys this side and it comes down both sides. That is what you see as your menses. Why this one is shedding off, we are now in the follicular phase. These are the two phases. The follicular phase means that there are hormones in the body which is called estrogen, the follicle stimulating hormones, which are responsible for the follicular phase. What happens is that follicle stimulating hormone, which is stimulated at the level of the brain, prepares the ovaries to get mature. There are a lot of eggs in the ovaries, so it prepares the eggs in the ovaries to get mature. So the follicle stimulating hormone is a hormone that acts on this with estrogen and makes one of these eggs to mature enough, because we have a lot of eggs in our body and not all ovulate at once. They ovulate each cycle, except in people who have genetic background where they can ovulate two eggs at the same time. But averagely, we ovulate one egg in each cycle. When one egg is being maybe matured enough, one egg starts like maybe small, it starts getting big, it starts increasing in size, it starts increasing in size, it starts increasing. So you see here that once this the small egg with the follicle stimulating hormone, it acts on this, it starts getting bigger until that is the biggest one now. And when it reaches the biggest one, what happens is what we call ovulation. Ovulation occurs here. This is the period of ovulation where this one egg actually bursts and comes out from, because all this is occurring but inside the ovaries. So this mature egg therefore bursts through the ovaries and gets into the fallopian tube. Once it gets into the fallopian tube, that's the period called ovulation. Sometimes some women usually feel ovulation pain because it's that burst when the egg bursts the ovaries and enters into the fallopian tube. Some women feel pain during this time. So some people might have that tendency to know their ovulation pain and know that this is when they're ovulating. And once they ovulate, this egg here has 12 hours to 24 hours to remain in this fallopian tube. If there is no sperm that comes and fertilizes egg, it dies. And once the egg dies, what happens? Once ovulation has occurred, the body tends to know that fertilization can occur. If a sperm comes and fertilizes this, what happens is that this inner lining tends to, if it was thin like this, if it was thin, it tends to start getting thick. It tends to start getting thick, because it knows that fertilization might have occurred. Now, this egg, it has 2 days to stay here. One day, after 12 hours to 24 hours, if no sperm has fertilized this, then it's going to die. But normally, the progesterone which is being produced in this luteal phase is still there, making these inner layers to become thickened. That is how the menstrual cycle is. When we have had this, how do you know your menstrual cycle? How do you calculate this cycle? Therefore, if you have, let's make a calendar so we all understand. This is Monday, Tuesday. So this is a calendar. Here, I always tell all women that I get to meet them, know your cycle. Yeah, sometimes many people use the app. Yes, that's fine for you. If you're comfortable with the app and it works for you, that is okay. But if you can't calculate, sometimes just to be sure that the app goes with yours, then you can also calculate and understand how the app works and know how it calculates. This is your calendar. I always tell every woman, have your calendar. I always have my own calendar. I mark at each point. Once I see my period, I mark, and I really put in my mind that hey, I'm going to be expecting my period this time, and I also mark. For example, because I know my cycle. Now, how do you calculate from your menses to the next menses? This is a calendar method. I didn't want to start on Monday. Let's say this is this January, and then this February continuing here. The first, let's say the first is on a Wednesday, then maybe your period it starts on Friday the 3rd. Let's say your period starts on Friday the 3rd. How do you calculate your cycle? Now you say, okay, my period has started on the third of on the 3rd of January. What do? You just circle this and you leave it. You can now in February, when did your menses come again? Let's say your period came in February on the 6th. We are now on the 6th of February, and you say, oh, I've seen my period again. So that is the end of the previous cycle. How do you calculate your cycle? The first thing is, it starts from this menses to the day before the next menses. What do I mean? It means to calculate your cycle, you start from the day that it flowed. So you flow, the period came when? On the 3rd of January. So you start calculating 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34. Now, so you have a 34 days cycle from our calculation here, because it is the day before. This seat is going to be the first day for the other cycle. So given that in March you see your period maybe on the 2nd of March, how do you start calculating again? You start calculating from the seat, you start 1. So the day that it starts is considered as day 1. So it is not, you see here that the 1st of January was on Wednesday, but you started calculating day 1 on the 3rd because that was when it started. If your period also started on the 10th of that month, that's day 1 of your cycle. I hope we are clear. So from here now, you calculate to the day before. So you count 1, 2. Therefore, if your period now in March comes maybe on the 2nd of March, how do you calculate it? You start from seat 1, 2. So that is why the seat is not included in this other cycle. So you just look for your calendar, use your phone. We all have smartphones. Many of us might have smartphones. Use your smartphone. Just go and mark it. Okay, I saw my period here. This month I saw my period here. And you start calculating from day 1, the day that it came, to the day before the next period. So if I see my menses now on the 6th of February, my calculation starts from the 3rd and it ends on the 5th, because I know that in March, if I see it on the 2nd, I'm going to start counting from 6, 1, 2, 3, 4 till the 1st to have my cycle. I hope that is clear. Please, it's as simple as that. Just take a calendar and do it. Just follow these steps. It's going to be very okay. Now, once you have calculated that and you have 34 days, most of the times when women come to me to help them calculate, when they book a consultation and I have to calculate their cycles, I always tell them, give me the first days of your period for the past 3 or 4 months. So it's going to give me 3 values. So maybe here from this to this we have 38. Then maybe from the 6th to the 2nd, or since we saw the period on the 2nd of March, therefore you'll be from the 6th to the 1st of March. I hope you understand. So this, we're going to have another value. March, April. In April, if you see it, you're going to start again from the 2nd to, maybe if you saw it on the 7th, you see it now from the 2nd to 7th of April. So you have 3 values. If we have a 34-day cycle here, and now in the other ones, you have maybe 29, and maybe the other time you have 29. You see here that your cycle is 29 days. Maybe these 34 days, something happened, that maybe you're stressed, you did a lot of heavy exercises, and it delayed your menses. So a delay for 3 to 4 days can be okay. 3 to 4 days difference from your cycle is very okay. But people will start having more than 7 days difference, then we start entering into irregular cycles. So you can have your cycle. You can even have your cycle, all the cycles. Normal cycle should be 20, from 21 days to 35 days. So you can have your cycle in between. If you have a 21-day cycle, that's from when we're talking about cycle, I hope all of us now understand. So it is from 20, from their menses to the day before the other menses is 21 days. So that is understood. If you have a 25-day cycle, if you have a 35-day cycle, it is normal, it is okay. When you start having 36 to 37 to 38 days, it means maybe sometimes you are not ovulating. You should consult. And if you have a cycle to less than 21 days, you should consult. Therefore, to calculate your cycle, to know your cycle, it is the average of at least 3 of your cycles. You see that if this one we just consider one, we would have been saying that our cycle is 34 days. But when we calculate now 3 other times, we see that it is 29-day cycle. So it's important that you calculate for 3 months. You should have 3 cycles to know the average. Now you might be asking me that if you have 28, 29, and 30, what is your cycle? You take the average of 28, 29, and 30. Most of the times it's 39, it's 29. So your cycle is 29 days. One, like I said, 2, 3 to 5 days away from their normal cycle, such that if you have 29, 29, and another time it comes 33 days, you will not be worried because maybe you travel that time, you're stressed, or there was exercise. Sometimes it can delay because of some environmental factors. Now we have known how to calculate our cycle, which is very important. What is the next step? To know your ovulation day, then know when is your fertile period and when is your unsafe days, and when can you get pregnant, when should you have intercourse in order to get pregnant. Because if you don't have intercourse during this period, especially for those who have partners who are not around, who always travel, and they just have to come, and at least when they come they want to get pregnant before they go back, then this part don't miss it, please. Now let's say this is our two phases we are spoken about, and this is our follicular phase and our luteal phase. How do you know your fertile period? Or let's start with the ovulation day. How do you calculate your ovulation day? Now we have a cycle. The most common cycles that many people have is the 28-day cycle. So if we have a 28-day cycle, so we have one here. This is day one. I hope we all understand when I talk about day one. Now we have the 28th. So this should be the day before this our next menses, if we all understood. So this should be day 28. This is day 28. Now, how do you calculate your ovulation day? Once you have your cycle, we have said you have the average after 3 cycles. You take now the average. Maybe this one was 28. You say 28 minus 14. What does it give us? 14. So our ovulation day occurs on day 14. Therefore, since we have our calendar, we had our calendar. On our calendar, we saw our period on in January. We saw it on the 3rd. When we start counting on the 3rd, 1, 2, 3. So once you reach that day 14, you circle that day 14 and you say, okay, this is my ovulation day. That is how they calculate. Now, why do we say that 14? Because the luteal phase is always 14. What brings the variation in people's menstrual cycle is the follicular phase. Here we have 14 days and 14 days. Someone who has a 35-day cycle, or there we spoke about, we calculated the other one was showing 34 days. Let's say the next one was 34. What do? You have calculated and you see that your own cycle is 34 days. You say 34 minus 14. What does it give us? It gives us 20. Therefore, it is your own ovulation day is on day 20. So how is this your own luteal phase? So you see here that you're having is going to be longer. Let's make it longer, definitely. So it's going to be like this from the menses. this still 14 days, right? So we still have our 14 year, because this is, yeah, 14 days. So 14 minus 34 is 20. So we see here that is 20 that is here. This is where you're having your own ovulation day on day 20. But in someone here, he's having on day 14. So this is where the variation occurs. Let's take someone who has 25-day cycle. This is a 28-day cycle. So 25-day cycle is going to be around here. We'll still have here. So we'll have 25 minus 14. It gives us 11. So here, between the next menses, so here we have here 11 days, while here we still have 14 days. So all through, these are 14 days remains, but it is this follicular phase that makes the difference. This is where you can calculate your ovulation day, and that is your ovulation day. If you have calculated your cycle and it's 33 minus 14 days, you have your ovulation day. That is how you do to calculate your ovulation day. Now, how do you know the fertile period? It was a calendar that we had, and we had a period on this. So we had a 34-day cycle. 34 minus 14, it gave us 20. So our ovulation day is on day 20 of our cycle. When you go and you calculate on that on your calendar, now we have had day 1. So this is day 1. So we have to calculate when is our ovulation day. We start is on day 20 of our cycle. We start 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So on the 22nd of this month, this is your ovulation day. How do you know the fertile period? The fertile period is 5 days before. 1, 2, 3, 4, 5. So you put like a line here, then 1 day or at least 2 days before, because sometimes you might not really catch the ovulation day rightly. So from here to 1 day or 2 days before. So this and this. So here, these are the period from the 17th of January. If you saw your menses on the 3rd, therefore on the 17th to the 24th of January, if you don't want to get pregnant, avoid intercourse during these days. And if you have to have intercourse and you don't want to get pregnant, you should use a condom. That is your fertile period. Why? Because the sperm of if you have intercourse just on this day, the sperm of a man can stay inside a woman for at least 5 to 7 days. So if this sperm enters here and you don't have intercourse even on this your ovulation day, that sperm is going to remain there till this 22nd, where ovulation is going to occur. And once ovulation occurs, the sperm is going to meet this egg, because it has stayed there till that egg is coming. Therefore, sometimes this our ovulation day might occur on maybe a day. It might not occur that exact day. So that's why sometimes we increase the days. So if you want to get pregnant, when is the best time for you to have intercourse? It's advisable to have intercourse from here. So you can have intercourse from here on the 17th and on the 20th, and you don't skip the ovulation day. Then you can have maybe intercourse on the 23rd and 24th. So it is just like if someone has to come, if your spouse is coming, he has to make sure that within this fertile period he is there, and the ovulation day he should not miss to have intercourse with his wife. And this is how you can do to get pregnant. But if you don't want to get pregnant, you can avoid these days. Then within all the other days till the next period, you are free, because it are your unsafe days, and you will not get pregnant, because the egg, once it ovulates, it stays yes 1 day, 12 hours to 24 hours, and it dies off. So if ovulation actually occurred here by 23rd, the egg should be dying. So 24th, even you have intercourse on that 24th, you might not get pregnant. So if the man is coming, he's flying in and he arrives on this 24th, you might not get pregnant. If this video was helpful, don't forget to give a thumbs up to our video. And if you like such content, don't forget to subscribe and hit the notification bell so that you're going to be the first person to be notified of any of our new videos. And if you want to have a private consultation with me, you can click on the link below and get our online consultations. You can book for one and you get to a one-on-one discussion with me. Don't forget to share these videos to every other woman out there. Thank you very much and God bless you.